The integumentary system, or skin, this has been put together by a fantastic lecturer of many years standing and experience called Mr. Graham Jones. He's a wonderful and learned chap, and if he speaks, we should listen. So, aims and outcomes for today's session. You will understand basic anatomy of the skin, some common skin conditions, and the psychosocial aspects of all of the above. So, the skin. It's skin. It's the largest organ in the body. It has an approximate area of about 20 square feet. It protects us from microbes and the elements and helps us regulate our body temperature, and it facilitates the sensations of touch, heat and cold. It has 3 layers. Okay, the epidermis is the most outer layer of skin. This gives you a waterproof barrier and creates our skin tone. The dermis, beneath the epidermis, contains a tough connective tissue layer with hair follicles and sweat glands. The hypodermis, or subcutaneous tissue, which is made of fat and connective tissue, is in there as well. A couple of different things on here. The bit that says sweat gland, but the bit that's missing, you can't really see, is sebaceous glands. Oh, there we go. Right, I'll draw on a sebaceous gland. There is a sebaceous gland, and they make an oily stuff that goes on the skin called sebum, and sebaceous glands make your sebum, which is the oil which provides the sort of bit of moisture to your skin and helps it with waterproofing. Occasionally these sebaceous glands can get blocked, in which case you will get a blackhead. And if anybody's ever squeezed a blackhead, you have this sort of like cheesy wormy stuff that comes out. If you smell it, it stinks. So next time you squeeze a blackhead, give it a smell and tell me where it smells of. It's just it's a lot of sebum. The medical term for a blackhead is a comedone, so comedones. So teenagers get covered in comedones. So other components of our skin. The skin has blood vessels in it and little capillaries. It has sebaceous glands, as mentioned on the previous slide. These can become cystic, and you can get huge sebaceous cysts. And if these, they actually then need to be surgically removed. If that cyst ruptures into the subcutaneous tissue, this can cause a raging cellulitis because there's quite a few bacteria in there, and that can become a surgical emergency. Sweat glands, they make the sweat. The sweat goes out onto the skin when we are hot, and as the sweat evaporates into the atmosphere, that is the action that cools us. Isn't that pretty clever? We cool by evaporation. That explains why, if you ever go to a humid country such as Florida with a subtropical climate, and when you get off the plane you think, wow, it's really, really warm, and you're outside and you're sweating loads, but because there is so much water in the atmosphere there, because the air is so humid, the mechanism of you sweating to cool down doesn't really work properly, so you just get hotter and hotter and hotter. You may notice it actually, if ever you're in a hot country that's very humid and you're driving along in the car and you open the window to let some cool air in, no, it just makes the car warmer because of the humidity of the atmosphere. Also, regarding evaporation and how you lose heat, it's illustrated again. If you ever get a pre-injection swab, which is alcohol in, and you rub it on your hand or your arm, as the alcohol evaporates, it draws heat with it. That's why alcohol swabs feel cold. Interestingly, it's a little point about alcohol swabs, is that they kill the bacteria by causing dehydration of the cell wall, and the bacteria pop. They just go. They're what's called a lyse, L-Y-S-E, get lysis of the cell membranes of the bacteria. So alcohol swabs kill the bacteria by evaporation. It just dehydrates the bug and kills it. Right. Anyway, colour. They also provide colour, melanin in our skin. There's lots of different shades of brown, from sort of light brown to black, and the skin's coloured by cells called melanocytes. And there's an abnormal tumour that one can get in one's skin called a melanoma. You can get a malignant melanoma, which can kill you as well. But anyway, just to say that melanin is in the skin. In light coloured skin people of sort of European descent, when the sun goes on our skin, it makes us a bit more brown. That's actually a sign of damage. So yeah, when you are nicely tanned and you look really healthy, well, it's not really that healthy for you because it represents an element of damage. So this is your skin reacting to try and protect you from the harmful UVB rays that come from the sun. Remember, B for bad. UVA, it just doesn't really penetrate too deep. UVB, B is bad. B is the one that gives you the skin cancer. And our hair follicles, and there's some hair under the armpits, naturally occurring hair in a female. Yes, females actually grow hair in their armpits and other places as well. How fashions change. Sometimes hair is acceptable socially, and other times it is absolutely not acceptable socially. It waxes and wanes with trends, but yes, males and females have equal axillary hair there. So, stages of wound healing, right? If we just look at the image at the bottom there, the nice cartoon, because that's more interesting than anything else at this moment in time, you can see that somebody's sort of had a scrape to the hand and photographed it every single day, and eventually it's slowly healed. So that's what we're going to describe now. So the first bit would be hemostasis. Okay, this is where you get a blood clot, heme, blood, and stasis still. So there's our blood clot there, in order to plug the gap and stop us bleeding to death and dying. Thereafter, we have the inflammatory phase. Okay, this is where you get inflammatory cells, such as your white blood cells like macrophages, come in and take away all of the bacteria and bugs that may be growing there. Additionally, fibroblasts that grow fibrous tissue will start to proliferate as well. At this point, then we'll have a scab over the top of it during the proliferative phase. This is where your fibroblasts are doing their best to rebuild the tissue that has been sort of damaged. And eventually that tissue will remodel over the course of anything up to about a year, and the whole thing should hopefully end up in a situation where you'd never known that it's actually happened. Okay, so there's some notes associated with this slide. I'll just quickly go over those. The inflammatory phase is the body's natural response to injury. After initial wounding, the blood vessels in the wound bed contract and a clot is formed. This is true. Once hemostasis has been achieved, blood vessels then dilate to allow essential cells, antibodies, white blood cells, and growth factors, and enzymes and nutrients to reach the wounded area. During proliferation, the wound is rebuilt with new granulation tissue, which is comprised of collagen and extracellular matrix, into which a new network of blood vessels develop, a process known as angiogenesis. Angiogenesis is growing your own blood supply. That's pretty cool. Cancer cells have the ability to grow their own blood supply, called angiogenesis. Okay, healthy granulation tissue is dependent upon the fibroblast cell itself receiving sufficient levels of oxygen and nutrients supplied by the blood vessels. Maturation is the final phase and occurs once the wound has closed. This phase involves remodeling of collagen from type 3 to type 1. There's lots of different types of collagen. Cellular activity reduces and the number of blood vessels in the wounded area do regress and decrease and go back to what they were originally. So, what is a pressure ulcer? A pressure ulcer is defined as a local injury to the skin or an underlying tissue, usually over a bony prominence, as a result of pressure or pressure in combination with shear. So there's the shear forces being applied, and I think the first bit was downward pressure over a bony prominence, the white bit at the bottom there. So, yeah, pressure ulcers. So as previously mentioned, they're caused by pressure, shear, friction, or a combination of these. So where do they develop? The answer is anywhere where there's a bony prominence. So if your patient's laid down, they can occur in the ear, the shoulder, the elbow, the hip, knee, the heel, the ankle, the inside of the knee, the ear, the occiput shoulder, all of these areas they can really occur. They can also occur if your patient's got a nasogastric tube in, if they have any adjuncts in. If the tube is pulling on the nose, you can get a pressure sore on the nose. So some notes about this: the total cost to the UK is estimated to be about 1.4 billion to 2.1 billion, which is about 4% of the total NHS expenditure. So if your patient ends up getting a pressure sore, it results in, it's just really bad for everybody. Nobody wins. The daily cost of treating a pressure sore is estimated to range from £43 to £374. Obviously depends on what's wrong with the patient. Yeah, for ulcers without any complications, the daily cost ranges from between £43 to £57, and that was work done by Dealey and others. That's DEALEY in 2012. These costs assume that your patients are cared for in a hospital or a long-term care setting, and but are not admitted solely for the care of the pressure ulcer. These are the daily costs in addition to the costs of standard patient care. So the stages of pressure sore, okay, grade 1, 2, 3, and 4, right, going from increasing severity. So a bit red, a bit broken down skin, a lot of broken down skin, and very much broken down skin, and sometimes exposed bone. right? So it's all horrendous. So the cost of treating a pressure ulcer varies from £1,214 for a stage 1 to $14,108 for a stage 4. So you can understand the rationale behind making sure your patients just don't develop these. Regular viewing of your patient's pressure areas. Whenever you're engaging in any aspect of personal care to your patient, you always check the pressure areas. Very common areas to get them are on the heel and on the sacrum. So you might hear in clinical practice, you might hear the nurses saying, "Oh, have you checked Mr. Smith's bum? Have you checked Mr. Jones's bum?" And you'll be thinking to yourself, why do you want to look at people's bottoms all of the time? The reason they want to do that is to make sure they're not getting a pressure sore. So you become adept at making sure that you look at your patient when you're delivering your personal care of cleansing and dressing, that your patient's not developing any pressure sores. And if they are immobile in bed, you will, with the rest of the team, facilitate the patient either to be on the appropriate mattress or make sure that they're turned regularly as well. Yeah. Okay, now what we're going to do is just break that down a little bit more, no pun intended. So grade 1, the skin turns red, similar to skin immediately after a minor burn. It may also appear a little bit harder than usual than the surrounding areas. Cost of treating this is approximately £1,214. Skin may be warmer than usual just because you got some redness there. Okay. Grade 2. Skin blisters with whitening of the skin, whereas before it was red, it now looks like a little bit of an abrasion or a blister. The skin can also appear cracked and broken as well. There's your grade 2. Grade 3. You have full thickness skin loss involving damage or necrosis. Necrosis means dying or death, dead tissue of subcutaneous tissue that may extend down to but not through underlying fascia. Fascia is just an avascular layer of tissue which is inelastic really. The ulcer has usually started to open at this point. The skin beneath it is more visible and red, and there may be a smell emanating from the ulcer. It now looks really quite unpleasant. Okay. Grade 4, there's now a deep ulcer. Okay, extensive destruction with tissue necrosis, damage to muscle, bone or supporting structures, with or without full thickness skin loss. Okay, what you can see in the image there, the yellow bits. This is this area here. This is like slough. It's called slough. It's a mixture of dead cells and sort of your white blood cells from your immune response. So if you've got slough in a wound like this, it won't heal. Okay, so this area here, just for instance, looks to be pink and is granulating nicely. This is largely granulating nicely as well. Still a little bit of slough around the edges, but yeah, this is a horrendous pressure sore. Yeah, that's slough and that's granulation tissue. Okay. Expanding on that, so your grade 4, there's a deep ulcer with broken skin, and you can see down through the layers of skin, often including damage to the muscle, bone or supporting structures. Grade 4 ulcers can be life-threatening simply because the patient has a huge wound and they are much more prone to sepsis. Cost of getting this to heal is approximately £14,108. So the cost to the patient really is can be life-threatening due to sepsis, can lead to severe disabilities or even amputation of limb, can lead to infection and osteomyelitis, infection in bone. If you get infection in bone, it is dreadfully difficult to treat and usually requires surgical debridement, which is chopping away of the infected bone and takes months and months and months of treatment. Extended hospital stays, the need for surgery or prolonged immobility, along with exudate and leaking dressings, possible malodor and embarrassment, but most importantly, pain and suffering. So you really don't have your patients get pressure sores because it's just horrendous. So there are many tools available to monitor your patient's pressure sore risk. They all have their own pros and cons, but this is called the Braden scale for predicting pressure risk. You have a score, and that score can determine the patient's likelihood of developing a sore. So this particular one looks at sensory perception, moisture, the patient's activity, mobility, nutrition, and any friction and shear forces. Don't worry about memorizing it, but it's just useful to know that it's a complex multifactorial thing, the development of pressure sores. So it's just to be aware of that really, and don't be too upset by looking at it, but know that they're out there. You know, pressure sore risk monitoring tools such as the Braden score. There is another one called the Waterloo score. Okay, again, this looks at your patient's weight, height, whether they're incontinent, the level of mobility, the skin type, the sex, the age. There's lots and lots of different things. Again, it gives you a score, and like the higher the score, the greater the risk. So again, don't worry about memorizing all of this kind of things, but just know that these things exist. Any words that you might want explained? Edematous. Edematous means swollen. So if there's any edema, something's edematous there. Yeah. Pyrexia is like Pyrex dishes. You put them in the oven; they're oven-proof. And a pyromaniac is somebody who lights fires. So pyrexia is a temperature, high temperature. Let's have a look. Yeah, apathetic patient will be not really very sort of active at all. Terminal cachexia means that your patient is very, very thin, and you tend to see this in end stage of cancer patients. And paraplegia is your patient is paralyzed from the waist down, as opposed to quadriplegic, where all four limbs are paralyzed. Another one is tetraplegic, where you're paralyzed from the neck down. So, what skin conditions can you name? As Voldemort in his dying moments. Or his skin flaking off. And oh, it's all flaked off and everything was flaky. Yeah, right. So, skin conditions. Cold sores. Right. So, cold sores are small blisters that can develop on the lips or around the mouth. They're caused by the herpes simplex virus. They form small fluid-filled sores that appear usually on the edges of your lower lip, sometimes on the upper lip. They are most contagious when they burst, but remain contagious until they're completely healed. Cold sores usually clear up without treatment within 7 to 10 days. Impetigo. So what is impetigo? Impetigo itself is a very contagious bacterial skin infection that causes sores and blisters. There are two types. There's non-bullous impetigo, which affects the nose and the mouth, and there is bullous impetigo that typically affects the trunk. You tend to get these sort of like fluid-filled sort of sores, which are sort of painful but highly infectious, very, very infectious indeed. Eczema. What is eczema? Okay, eczema makes your skin itchy, red, dry and cracked. It can affect any part of the body, but most commonly affects the backs or the fronts of the knees, outside of the inside of the elbows, around the neck, the hands, the cheeks or the scalp. Treatment includes using moisturizers, and topical steroids can help relieve the symptoms. Infected eczema, on the other hand, is common in people who have frequent sores and open wounds associated with their condition. However, not all people with eczema will experience infections. This is an eczema that's been complicated by staphylococcal infections. That means there's a Staphylococcus aureus somewhere amongst there causing infection. Next we have psoriasis. So what is psoriasis? It typically causes flaky red patches of skin covered in silver scales. The patches usually appear on the elbows, the knees and the lower back, and they can be really quite itchy or sore. There are three differences between eczema and psoriasis. In general, psoriasis has thick red patches covered with silvery white scales of dry skin. In eczema, skin is dry and reddened. The cause of eczema is usually environmental factors like an allergy, a product ingredient, or even stress, whereas psoriasis is an immunity response linked to infection, hereditary or genetic links. Age. Eczema can occur in very young people and kids, 1 in 5 children. And psoriasis doesn't usually sort of hit until you reach adulthood. Occasionally from age 11, in 2% of the UK population have it. However, it's important to illustrate that none of the above here are actually rules, and rules are there to be broken. So when it comes to the way pathology actually develops, the patient is rarely read the textbook, and therefore the pathology rarely goes precisely how the textbook would describe it. So there you go. So what is ringworm? Well, ringworm is not a worm. It's a contagious fungal infection that typically affects the arms and the legs. It causes a red or silvery scaly rash in the shape of a ring. Anyone can get ringworm, but it's more common in children, and you can treat it with antifungal creams. So, what are scabies? There's a little file of a real live scabiing. Okay, scabies are contagious skin condition caused by tiny mites that burrow into the skin. The main symptoms are absolutely intense itching that gets worse at night, and a rash of tiny red spots as the scaby mite just sort of digs and eats in and around your skin, and you scratch away at it like crazy. Okay, melanoma. What is melanoma? It's a type of skin cancer. It develops from cells called melanocytes. It's a skin cancer that's the 5th most common cancer overall in the UK. Around 13,500 new cases of melanoma are diagnosed each year. More than 2,000 people every year in the UK die from melanoma. And there is the A, B, C, D, E of melanoma. So I'll give you the A, B, C, D, E now, and then we'll talk about these little images. So A is asymmetry. So you should be able to draw a line down any normal mole, and it should look symmetrical on both sides. If it doesn't, it could be a malignant melanoma. B, border. If the border is irregular, so the borders of normal mole are nice and smooth. If they are irregular, if it's an irregular border, it could be melanoma. C, colour. So if there's more than one colour in it, it could be a malignant melanoma. Usually your benign moles have just one colour. D, diameter. More than about half a centimetre or 5 millimetres, and it could be a malignant melanoma. E, evolving. If it's changed in any way. So any of those, get it looked at by somebody who knows what they're doing. So here is just some of the things, back to the image now. So we've got asymmetry, 2 sides don't look the same on the first image there. Second one, border, the border is very irregular. C, colour, there's several colours in that particular one. And D, diameter, is bigger than half a centimetre, okay? The end of a pencil. E, evolving if it's changing as well. Okay, a bit of a quiz. What is the external layer of the skin called? Epidermis. Approximately, what is the total area of the skin in square feet? That's 20, I think. Yeah. What is the lower area of the skin called? I think it's the dermis. Or hypodermis or subcutaneous. Yeah, okay. What type of tissue is this layer made up of? It's fat, I think, isn't it? Yeah, fat and connective tissue. I'm doing this quiz as well, actually. What is caused by the herpes simplex virus? What is caused by the herpes simplex virus? Oh, cold sores. Yeah. What condition is being described? A contagious fungal infection that typically appears on the arms and legs. Contagious fungal infection. I want to go for a ringworm. Yay. How many people die each year in the UK from melanoma? That was 13,500. We've just done that. Oh no, wrong. More than 2,000 people die every year in the melanoma. What's 13,500? 13,500 diagnosed. 2,000 people die. Dope. Something is a contagious skin condition caused by tiny mites that burrow into the skin. The scabies. Ugh. There are some references. If you wish to do any further reading, I suggest you press pause and copy it down. Congratulations, you've reached the end of the presentation. Well done.